My name is Pam Dalgleish and I live with my husband Richard and my son Robbie. Robbie has a condition called neurofibromatosis type 1. It's a relatively common genetic disorder which affects people in different ways. Some people get lumps and bumps on their skin and that's all that's wrong with them. And some people can get other symptoms which could be tumours in the brain or an optic nerve. It could be learning difficulties, problems with vision. And sadly, Robbie's managed to get quite a few of the more serious problems with the condition. He was diagnosed with a brain tumour and he had an operation. Unfortunately, has led to a decline in Robbie's mobility. Robbie was walking before and seemed mentally more able. So following this operation, although it's saved his life having the operation, it's left him with a decline in his mobility, decline in his sight. He's now registered blind. The age Robbie is now at 17, he's still needing looked after like a child much younger, whereas friends will have independent 17-year-olds that are able-bodied. We've just had to learn to deal with things as they've happened to Robbie, and Robbie's so lovable that it's easier to deal with him because he gives so much back and he's happy and good-natured. Robbie goes to the Royal Blind School. The staff are wonderful with Robbie. He has his class teacher and also classroom assistants in a very small class of just a handful of pupils. And then he goes down to his house at night where he stays and he's well supported there by nurses and his key workers. They know him very well, he knows them very well, which is just wonderful because everybody likes to have that sort of security of knowing people and what's going on around you. He stays there Monday to Friday and comes home for holidays and for weekends. I think we've been quite lucky that we've been well supported with Robbie. We've been well supported by various medics at the hospital, and there's also other valuable charities like Kindred, which is based at the Sick Children's Hospital, that can provide parents with valuable information and support. And other people that support us greatly is Rachel House. Robbie goes 4 times a year to Rachel House. One of the downsides of Robbie being residential at the school is that that uses up our allocation of respite. So we get very little cover at weekends or evenings while Robbie's at home to allow us to go out and do stuff away from Robbie. Do appreciate that he's well supported during the week, but at weekends is the time when my husband's here. My husband works full time, so he's not here during the week to do activities without Robbie. It's at the weekends you feel, when friends are off work as well, that you want to go out and do stuff as a couple. Robbie's been supported by multiple agencies and organisations. One of the things that was a great benefit to us was the Special Needs Play Scheme, which was based in North Berwick. This is where he got picked up by a bus and he met lots of other people his age and they did fun activities. And this was great for him because when you've got a learning difficulty, it's sometimes hard to go out and meet people the way that you and I would go out and meet people. Well, Robbie's at a real turning point at the moment. Robbie's 17, so he will be moving into adult services to be looked after by adult social workers, etc. And also he'll obviously be leaving school at the end of the year. We're hoping that Robbie will move on within the umbrella of the Royal Blind. So hopefully Robbie will stay within the school and live away from home like any young people would wish to do. The Beach Wheelchairs is a new charity. It's only been in North Berwick for a few years. We went down, met somebody that represents them at the harbour who helped us into the chair. He's blind, so he can't see where he is, so it's a really good experience for Robbie to have the different sounds and smells and things to touch. All these carers that come in, he has to know their name, where they live, what car they drive, and he remembers things like that they tell him. I would say there's been quite a big turnover of staff for the carers that come to visit Robbie at home. This is partly because they've moved to other areas and also because staff have left. This is something that I flagged up directly with the agency and said that I would appreciate it if they kept the same core carers coming to visit Robbie, and they have actually tried to implement this. So we've got carers that come to the home to get Robbie up in the morning and put him to bed at night. Thinking about the future long term is a bit scary, but I think that's scary for all parents of children that are moving on, leaving school, going to university. It's different from us. It's quite sad for us that our child isn't doing what other young people his age are doing, but we've just tried to accept that Robbie's Robbie and we love him, and I think he loves us, and he's such a happy boy that we make the most of his life and what he can do.